Morning. My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided visualization, nutrition and exercise. My web address is www.gianinc.com. Today's topic is going to be chronic female pelvic pain. This is not an uncommon condition. There are females who suffer the chronic pain due to organic causes. In other words, one can find a cause for the pain, such as a fibroid uterus or a condition called endometriosis, where during their periods, patients with this condition bleed outside of the uterus, irritable bowel syndrome, or chronic bladder irritation. And these conditions are organic, and usually the doctor investigates it and is able to treat the cause. We want to concentrate on the so-called inorganic causes where there is no actual cause found. The pain is located below the navel or belly button and can vary in intensity from mild to severe to cramping, stabbing, etc. For the definition of chronic pelvic pain, the duration is important, and it must exist for a minimum period of 6 months before the diagnosis is made. In the inorganic forms where no medical condition can be found, there is one condition called neuropathic pain, the pain being caused from irritative nerves as a result of previous infection or surgery adhesions. Those tend to make up the minority of pelvic pain sufferers. The vast majority of females who suffer chronic pain, there is no physical cause found. Studies have shown that sexual abuse can be and is most probably the cause of chronic pelvic pain, non-organic type. The sexual abuse could have taken place when the female was still very young, and this has been suppressed in her conscious mind, or the sexual abuse could have taken place when she was older, as a teen or an adult, and could have even been inflicted by her partner. This type of pain leads, in 90% of the cases, to depression. And when the female is depressed, depression aggravates the pain. The question begs of itself, how do you treat it? Well, a traditional physician will prescribe some over-the-counter anti-inflammatory medicines, and if that doesn't help, will prescribe heavier narcotic medication. This is not our belief as we practice holistic medicine. There is nothing but nothing else that can help as much as a session of medical hypnotherapy. During that stage, the patient is put in a deep trance and discussions are taken place, and often the subconscious mind is delved and the patient will admit to sexual abuse. Because that severe effect is sometimes repressed in the memory, especially when the females were much younger, because it was so painful psychologically that it was suppressed in the memory. And that memory is brought to the fore while in a state of hypnosis. One session only is required. During the hypnosis, the depression will also be treated and managed. Because the females have so much pain during intercourse, they tend to desist from performing and making love. And this in of itself has got a negative effect on the female and her partner. Guided imagery and medical hypnosis is assured to be of assistance to females with chronic pelvic pain of the non-organic type. The session is recorded, and you listen to our voice twice a day. The hypnosis session, listen to it morning and night, and when the pain does appear, if it does, we show you certain trigger mechanisms to use which will cause abatement of the pain. As mentioned previously, we are now doing telephonic consultations, and the patients feel at home, literally and figuratively, because they don't have to come to our office and feel more comfortable at home. My web address again is www.gianinc.com, and I thank you for listening.